Hello. Thanks for coming this morning. My name is Bob Cusack, Editor-in-Chief of The Hill, and I'm delighted to welcome you all here today to our event, Unlocking Access to Oral Health, where we will discuss the progress made and what more could be done to improve oral health care nationwide. I'd like to thank our sponsor, CareQuest Institute for Oral Health, for their support of today's event. Today, with the help of members of Congress, medical professionals, and oral health advocates, we will be exploring what the federal government can do to support states and ensure access to quality oral health care. But before we get into this important discussion, I'd like to address a few housekeeping notes. In addition to our audience here in the room, we are also live streaming this event on thehill.com. Please keep your phones on silent for the duration of the program. However, we do encourage you to join the conversation, as always, on social media. You can follow us on Facebook, Twitter, Instagram, at The Hill Events, and we'll be using the hashtag The Hill Oral Health. And with that, I'd like to welcome my first guest, Democratic Representative Jan Schakowsky of the 9th District of Illinois. Please welcome the Congresswoman. Thank you so much.
Okay, good.
Well, you know how this works. I usually ask you questions, but talking backstage, we're going to flip the script, and you've got a question for the audience.
Okay, so please, if you would raise your hand, how many of you have really terrific dental insurance?
Okay, about
two people, and that I'm
it might have been a little more than two.
Yeah, I thought that's way more than I thought we were going to have, and that means to me cleaning and screening, and root canals, and crowns, which are scary words for a lot of people. We don't have a lot of good coverage for dental care in this country.
And that leads into the question, where are we as a nation? You know, when I used to cover healthcare for a trade press newsletter back then, really before the internet got going, and I would pitch oral health stories, and I wouldn't get a lot of excitement from my editor. I would still do them. But where are we, and why is this issue underrated?
Well, it's underrated unless you have a big toothache. And 74 million people in 2019 had absolutely no dental health insurance, no coverage at all. And it's a serious healthcare problem. It can actually lead to more diabetes, increase in diabetes, and multiple cancers. I mean, dental health is a really important issue, and I would say while it's way under addressed, it can't be underrated. And we also know that I have some statistics that 29% of low-income people say one of the reasons it's hard to get a job is if they don't have the presence of their teeth in a good way. So it affects all aspects of life, and seniors are greatly affected because, as you know, Medicare does not cover. Well, it doesn't cover dental, it doesn't cover eyes, it doesn't cover hearing, and these are really, really devastating problems for older Americans who. Again, if you don't have good dental care, it can affect all aspects of your life. So this is, there in other countries like in Great Britain, it's part of their healthcare system, their healthcare coverage.
Right.
In the United States, it just really isn't.
And what should, when Build Back Better was moving its way through Congress, there was a lot of talk of expanding a lot of services, including dental.
Yep.
What does Congress need to get done? Obviously, maybe not in this Congress, but in the future Congress.
Well, I've been part of a letter that went to CMS that says that, can CMS move ahead and try and do something on this? I don't know.
Like administratively, instead of without legislation.
Administratively, they seem to agree on that. They're beginning to look at that. But I think that, certainly you would hear from most Americans that and especially seniors, Medicare. And Medicaid, by the way, it's an optional coverage, except for emergency care, and 36 states only cover for emergency, and that includes also DC. So it's really not very available. So if we could do something administratively, that would be good. There's enormous support for doing it as a Medicare benefit as well.
As far as the pandemic, how do you think that has set dental health back? Because a lot of people just haven't gone to the dentist.
Well, I don't know about you, but my dentist was not operating for most of the pandemic, as you can imagine, that kind of close contact. I will admit before all of you that since the pandemic, I haven't been back. I brush like crazy and I floss every night. Just saying. But
you should get checked out. You know,
absolutely, I know that. I will. Okay, Bob, I promise. I will. So clearly there was this big drop off in all kinds of healthcare screenings, and I'm sure dental care for many of you. I don't know if any of you were able to go to the dentist during the pandemic.
As far health, you've been a healthcare leader for many years. Healthcare, as you know, can be partisan, but it can also be bipartisan. 21st Century Cures Act, oral health, you would think would be bipartisan. Is it?
It's bipartisan if you ask people. When it comes to legislation, harder to do. And the expansion, as you know, in the Build Back Better legislation, we actually did add those benefits. Yep. But there is no Build Back Better. And so it didn't happen. We're fighting for more care. And I think that it certainly shouldn't be a partisan issue when it comes to healthcare. The other thing I think to note is that when it comes to FQHCs, the public health, the community health centers, very few are able to offer dental care. I'm lucky in my town of Evanston, Illinois, the Erie Health Center. They actually have dental care there. Not very, very common. So low income people, dental care is really hard to afford. Can I give you a few dollar figures?
Absolutely.
They're just pretty shocking on how much health care can cost. We know that the cost even of a screening can be like $50. But then when you get onto a root canal, it can be $800 to $1,800. A crown, $1,000 to $3,500. I mean, these, and a lot of that is not covered by insurance, and so it's not done.
Right.
And
you touched upon it. So in Illinois, different states have different rules. Illinois is better than most as far as dental care. You get that sense?
Not great.
Not great, but okay.
Again, Medicare. So Medicare Advantage. Some of the Medicare Advantage programs offer some dental care, but in Illinois, the networks are so confined. It has to be an in-network doctor, and because they're so limited in states like Illinois, so it's not very good.
We're going to talk about it on a panel conversation, but then there is the question of cost, and just like COVID, the more you invest in preventive health, it'll pay you back, and obviously many in oral health make that argument. As far as Medicare and Medicaid, which you've been working on for a long time, what needs to be done for the sustainability of both, especially Medicare, which is going to need some type of fix because it is headed for bankruptcy?
It's just really incredible to me that we think we should eliminate or reduce the kind of federal funding for these programs. So what is the consequence of that? It means that people don't get the health care they need. The United States is unique in the world in that saying that we think of health care as a right of all people. Of course, I'm in favor of a Medicare for all program. And as you point out, at the end of the day, I think that we see the kinds of savings in health care. If you don't provide these basic preventive services, then people are going to end up sick. They're going to end up in the hospital, and they will become a public charge of some sort, or they're just going to die. Is that the standard for the United States of America? We can do much, much better.
Healthcare, obviously, a big issue, and poll-wise, it's a big issue for Democrats because they poll better than Republicans. As far as the Inflation Reduction Act, which had some healthcare prescription drug legislation in it, do you think that was a signature win heading into the elections fewer than 50 days from now?
Oh, there's absolutely no question about it. When it comes to healthcare, again, particularly for older Americans, when you cap the cost of prescription drugs at $2,000 a year, which sounds like a lot of money, but I run into seniors whose bills are $2,000 a month for their life-saving drugs. That says that insulin will be $35 a month out of pocket maximum. These are absolutely really great things, and we begin to negotiate with the pharmaceutical companies that Medicare can start negotiating for lower drug prices. Let me just say that this is a huge issue for Americans, and we pay, as Americans, 2 to 3 times more for the exact same drug available in other countries. I mean, we're a bunch of chums when it comes to big pharma. And so this, and it says actually that if the pharmaceutical cost is higher than inflation, that they will be asked, pharma companies will be asked to rebate. So, we're making some progress here, but, we as Americans can do better. But I think, we're here talking about dental care. I think it is one of the absolute biggest failures that most Americans, just a few people here in this room, and these are people who one might assume can afford the dental care that they need. But you live in fear of a crown. No, please.
Yeah, that's
I can't.
Scary stuff. Yeah,
Yeah.
As far as policy making, obviously it comes down to elections, and the midterms are coming up. A few months ago.
Really?
Yeah.
I heard that.
I didn't know about that. It's going to be a big thing.
Less than 50 days. I think it's 49 days.
Yeah. We did a big story on 50
counting?
days to go. What's the mood in the House Democratic Caucus? Obviously, a few months ago, it was looking grim for both the House and the Senate. Things have changed, though. Do you think you can retain the House, and then next year, if you did, and the Senate, you'd be able to build upon what you've already passed this Congress?
We're going to win.
You're going to win.
Oh, we, Democrats. We're going to win. We're going to win. The enthusiasm, I've been an organizer for most of my life. I can never really remember a time when there is so much energy out there on the Democratic side. And I have to say, any poll that was taken before the Dobbs abortion decision, forget it, throw it out the window, because we are seeing a tsunami of women. But it's not just that. I think the fact that we actually can count up delivering for the American people, as you mentioned,
Yep.
the Inflation Reduction Act, which does so many things in terms of the climate and in terms of healthcare. So I am feeling very, very positive. I've also been on the recruitment committee for the Democratic Congressional Campaign Committee. I believe we have superstars out there. And I have to say that when even Mitch McConnell has some disparaging remarks about some of the
His own
winners,
candidates.
Republican winners of the primaries. I feel especially energized and excited. Yes.
That would be a historic win if you were to defy the odds, historically based upon what is normal. Of course, we're not living in normal times.
Is anything normal right now
No.
out in politics
Yes,
right now?
yeah.
I mean, I just haven't seen it, and of course, there's a downside, I think, for us to lose, but I think the upside, as you mentioned, being able to address these questions of healthcare, to address the concerns of Americans right now, voting rights, human rights. I think the sky's the limit in being able to pass so many important things that protect our democracy.
Last question, you've worked with Nancy Pelosi for a long time. If you defy the odds and keep the House, well, you think she comes back as Speaker?
She was asked that once recently.
Yeah.
And she most properly said, she's focusing 100% of her time, as I am, on the upcoming
winning.
election,
Yeah.
and that will, of course, determine
Everything.
what she's going to do. I think even set the stage for what happens in the presidential election in 2 years later. So we don't know. This is. I think really to be decided in so many ways in less than 50 days.
Yes, politics is
Vote.
unpredictable. We're out of time, Congresswoman. Thanks so much for joining us. Please thank the Congresswoman.
It's been a pleasure. Thank you. Thank you. Thank you.
Thank you.
Okay. Thanks, Bob. Okay. Can you help me down?
Oh yeah.